What if itching isn't just dryness? Especially after 60, when the body becomes more sensitive. Sometimes itchiness isn't irritation, it's a warning. We've always thought of itching as nothing. Since childhood, we were told, just scratch and it'll go away. But as we age, it may not be so simple. After 60, itchiness can be one of the earliest signs of hidden inflammation, metabolic issues, or even a more serious condition, especially if it keeps coming back in the same spot. That's no accident. The body has its own map of signals. Sometimes itching is just skin, but other times it's the liver, the thyroid, diabetes, or even the first signs of cancer. And it's better to know early. The body doesn't speak with words, it speaks through sensation. And itching is how it says, look here, something's off. If you're over 60, don't brush it off as just age or dry air. It might be the only clue that something's going wrong inside. Don't panic, but do pay attention. Where exactly does it itch? When did it start? What else is going on in your body? We'll explore 5 body zones where itching isn't just discomfort, it's a symptom. And we'll show how to read these hidden warnings. Sometimes, a moisturizer is all you need. Other times, you may need a blood test. The key is knowing the difference and not missing the moment. This information might save your health, or someone else's, especially if you're the kind who quietly endures and doesn't complain. We've put together only honest, helpful insights. No fear tactics, no fluff. Just what truly matters for those in their later years. But before we start, hit subscribe. Here we always talk clearly and directly about the body and health after 60. And in the comments share if you've ever had mysterious itching. Where exactly? We read everything, and we reply. Now let's dive into the 5 zones you should never ignore when they start to itch. The first zone, often overlooked by older adults, is the feet and toes. Itching here might seem minor, bad shoes or dry skin, but with age, it's more than discomfort. It may be a warning sign of a serious infection developing silently. Be alert if itching occurs between the toes or on the balls of the feet, especially in hot weather or after wearing shoes for long periods. These are classic areas where fungal infections thrive in warmth, moisture, and vulnerable skin. Fungi don't just cause itching. They penetrate the skin, weaken its barrier, and trigger inflammation. Older adults might not feel pain immediately, as skin sensitivity changes with age. The biggest danger is ignoring it. It starts with itchiness, then cracks, then infection. This is especially risky for those with diabetes or varicose veins. Healing slows down and complications rise fast. Many develop chronic athlete's foot, a fungal infection that doesn't go away on its own. It hides only to return again and again, slowly breaking down the skin over time. Key early signs include itchiness that worsens in the evening, peeling skin, tiny blisters, or redness between toes, and foot odor. These are signals to act, not to wait. Nails are important indicators. If the itch spreads to the toenail and it begins to yellow, thicken, or crumble, the fungus is already deeper. This calls for treatment, not just observation. Untreated fungus becomes chronic. It not only damages the skin, but opens the door to bacterial infections. It's especially dangerous if you notice odor, burst blisters, or pus. The good news: fungal infections can be stopped. The key is not waiting until it's bad, but acting at the first sign. Itching is an opportunity, not a sentence. Make foot inspection a morning and evening habit. Use a magnifying mirror if bending is hard. Even small changes in skin color or texture are reasons to take note. Wear breathable shoes and change your socks daily. Don't use the same pair of slippers for weeks without washing. Hygiene is your shield. After showering, thoroughly dry the skin between your toes. Don't leave any moist areas. Use a paper towel or even a cold air hairdryer if needed. At the first signs, use an antifungal cream. Don't wait for symptoms to develop. Use it for at least 2 weeks, even if the itch goes away. Otherwise, it will return. If itching remains after treatment or ulcers appear, see a dermatologist immediately. Better early than late, especially if you've noticed reduced sensation in your feet. Feet aren't just your base, they're a mirror of your health. If they itch, your body is telling you something. Listen and respond in time. The second zone you must not ignore is the back of the neck and upper back. Many seniors feel itchiness, burning, or a crawling sensation there. It's not just discomfort, it's a signal. Often this itch is blamed on sweating or the wrong clothing. But in older age, it could point to vascular issues, spinal tension, or even deeper organ signals. This area holds critical nerve endings. If irritation appears, it might reflect pressure, inflammation, or disrupted blood flow. As we age, neck mobility decreases, muscles stiffen, skin thins, and blood vessels lose elasticity. All of this heightens sensitivity and triggers itching. Sometimes the itch in your neck isn't about the skin, it's the spine. When discs compress and nerves pinch, the body sends signals through the skin, especially if the itch occurs in the same spot between shoulder blades or under the skull. It may be a sign of cervical osteochondrosis, or it might stem from pinched autonomic nerves. These episodes often include tingling, dryness, and irritation. It can go the other way too. The itching gets worse with stress, anxiety, or fatigue. That's a psychosomatic response and should not be ignored. If the itch comes with rash, flaking, or discoloration, see a dermatologist. It might be contact dermatitis or eczema. But if there are no visible signs, yet itching persists, check your spine, liver, and gallbladder. Everything is connected. Gentle neck exercises can help. Small circles, stretches, shoulder locks. No pain, just slow movement with breathing. Hygiene matters too. Showering after sweating, avoiding high-collared clothes, and using natural fiber pillows. These soothe irritation. You may apply soothing creams, calendula, chamomile, or menthol-based. But the key isn't the cream, it's addressing the cause. If you feel itching here, don't wait for it to pass. Listen, it may be a message from your nerves, muscles, or organs. Sometimes simply observing this symptom can help you catch a condition early. Itching is not always harmless. Sometimes it's a warning. The third zone is the abdomen and right upper quadrant. If you feel itching, tingling, or burning here, don't ignore it. Often, people blame it on food, sweat, or tight clothing, but it may be a sign from the liver, gallbladder, or pancreas. The liver doesn't hurt, it sends no direct signal. But when it's overloaded, the skin starts reacting. And itching is often the first sign. Itching in the right side may mean bile stagnation, especially if it appears after meals, worsens at night, or comes with heaviness. It may also be a response to fatty foods, alcohol, or medications. The liver and bile ducts react first, and the skin mirrors that reaction. With liver issues, small rashes may appear barely visible, especially on the abdomen, chest, or back. Sometimes itching is the only symptom. No pain, no fever. But the liver is already overloaded, and the body is asking for help. What to do? First, remove external irritants, tight clothing, synthetic fabrics, harsh detergents. These make the problem worse. Second, rethink your diet. Reduce fatty, fried, and sugary foods. Add milk thistle tea, warm lemon water, and boiled beets. Third, check your liver. A basic ultrasound and blood test will show if there's overload, fatty liver, or bile stagnation. If the itching worsens at night, that's significant. The liver works most at night, and the skin's reaction isn't random. Pay attention if itching comes with bitter taste, tongue coating, or pale stool. These are all liver-related markers. Important, don't start herbal liver teas without diagnosis. Sometimes they harm. First, get tested, then proceed gently. Abdominal skin reflects inner health. Itching here isn't about allergy. It's about metabolism, filtration, and bile flow. Pay attention. Sometimes itching means the liver is struggling, and the sooner you catch it, the smoother the recovery will be. The fourth zone under the knees and the inner thighs. This spot rarely raises concern, yet it's where problems related to veins, metabolism, and lymph flow often begin. The skin here is especially sensitive. Veins, lymph nodes, and small capillaries run through this area, and over time, they lose their flexibility. Itching under the knees can show up after long sitting, in heat, or at the end of the day. This is an early signal the venous system is overwhelmed. The inner thighs are an area of friction, moisture, and stagnation. If there's itching, it may be more than skin deep. It might be lymphatic stagnation. With time, leg muscles lose tone, blood and lymph flow worsens. This leads to swelling, itching, and heaviness in this area. You should be alert if the itching comes with redness, patches, heat, or numbness. These could be signs of vasculitis or diabetes. Many think it's just clothing irritation. but fabric may only trigger an underlying problem, one that shouldn't be ignored. The skin in this zone may thin out, dry up, or crack. That's a sign of hormonal changes and reduced moisture in the tissues. Sometimes itching starts after a shower or bath when vessels expand and the skin loses its protective layer. This may be an early sign of thermoregulation issues. It's crucial not to scratch this area, especially in hot weather. Skin damage here can trigger inflammation and impair lymphatic drainage. How to help yourself? Step 1. Move. Walking, gentle exercises, and leg rotations improve circulation and reduce stagnation. Second step, cool the area and care for the skin. Use cool compresses, alcohol-free lotions, or a moisturizing cream with panthenol. Third step, monitor your blood sugar and pressure. These directly affect itching, swelling, and vein health. Fourth step, see a doctor if the itching lasts more than a week or worsens. It's wise to check veins, lymph nodes, and glucose levels. And most importantly, don't accept it as just age. Itching isn't a sentence, it's an invitation to care for yourself more deeply, especially in these overlooked areas. The fifth zone, the back and shoulder blade area. This is often where itching starts for no reason, but behind it could be serious signals from liver issues to metabolic disorders. Itching between the shoulder blades or slightly lower is common in people over 60. Especially in the evenings or after sleep. It's easy to dismiss, but it's not random. This area is connected to internal organs, liver, gallbladder, and pancreas. Itching here may reflect overload or dysfunction in these systems. One of the early signs of liver trouble is skin itching without a rash, particularly in the back, sides, and shoulders. This may be caused by toxins and bile acids building up in the blood. They irritate skin receptors, and the body sends out an alarm. Be especially alert if the itch comes with a bitter taste in the mouth, fatigue, heaviness after meals, or dry skin. Sometimes it's a sign of metabolic imbalance, like in type 2 diabetes. There too, itching appears on the upper back or sides. In men, it can be linked to prostate inflammation. In women, gallbladder overload. And itching is often the first whisper. It can also be a sign of senile xerosis, age-related skin dryness, especially if you're low in omega-3s or vitamin D. Finally, it may be the body's response to stress. If the nervous system is exhausted, the skin reacts right in this zone. What to do? First, don't ignore it. Itching in this zone may be a silent symptom that saves you from a late diagnosis. Support your liver. Drink more water, reduce fatty foods, and try milk thistle or turmeric capsules. Simple but powerful steps. Get an abdominal ultrasound. Check liver enzymes and blood sugar. Better to be sure now than regret it later. Moisturize your skin. Use oils or creams with omega fatty acids. They reduce itching and strengthen your skin barrier. And most importantly, don't stay silent. If your body itches, it's speaking to you. Listen, it might be the wisest decision you'll make this year. We've gone through 5 zones where itching isn't just irritation, it's your body's possible call for help. These zones aren't random. They're connected to vital organs, your metabolism, and your nervous system. Not every itch is a danger, but every itch is a reason to pause, listen, and investigate. Older people often stay silent and endure. But the body is asking for attention, and if we listen in time, we can prevent serious issues. You're not alone. And you're not being fussy, you're being attentive. And that's mature self-care. Support those over 60, share this video. It might help someone protect their health. Subscribe if you value honest, simple, and deep information about the body after 60. Leave a like if this video helped you better understand your body. And in the comments, tell us which zone itches most often for you. It might help others pay closer attention. Thank you for being with us. Take care of yourself. Listen to your body, and see you in the next video.